Okay, so this is a grappler, and after doing heavy submissions, submission holds, and a real heavy training session in Brazilian Jiu-jitsu, he came out of there with brain fog. He got stuck in fight or flight, visual snow, disorientation, dizziness, derealization, and a lot of other symptoms that he's not comfortable talking about. Okay, so looking at you from behind, first thing we see is the crookedness. Okay, so we adjusted your atlas today. We care about that. C2 is drifted to the left. There is some ligamentous looseness back in here. It's gone too far forward. So you have grappled people that weigh 150 pounds more than you. And this is kind of what we found in here. So it could be argued that you were born with a tortuous internal carotid artery, but fine, but I believe it made you vulnerable to these choke out submission holds, and the soft tissue got pushed up in here a certain way. Is it worse than it used to be? Well, I can tell you when we try to touch it or go in there, you get all your symptoms magnified. So what do we have here? There's a carotid sheath that surrounds these. Well, actually, look at the other side. This is the normal side where everything is straight oriented. The carotid sheath is nice and tight. The vagus nerve, the glossopharyngeal nerve, the spinal accessory nerve goes through there. There's ganglions in there. Sympathetic chain. Actually, the internal carotid plexus goes as a sympathetic plexus goes around, surrounds this internal carotid. So how much of this is you were born with it and how much of it was trauma? Well, I think when you have these vascular anomalies, the way you get injured is different than other people. So this is what we found. One of the things you know is that when you bring your head down, you choke yourself out. And this internal carotid, tortuous internal carotid, is acting like a space-occupying lesion and pinching into your, and cutting out your internal carotid, your jugular. The styloid is not an issue. On either side is not an issue, but this is functioning to cause constriction. And of course there's nerves in there, and you get a vasovagal response. So is it the vagus nerve that's getting entrapped? And then the other component is when you got choked out, the soft tissue is not only being displaced, and we have evidence of it elsewhere on the other side too, but the ligaments in here have gotten loose. So even though by textbook you're not hypermobile, the textbooks is kind of, well, our understanding is in flux. So in this case, you not only have a tortuous left internal carotid, you have a tortuous left vertebral artery. Now, when this vertebral artery on this side does this, it's called a Dolichoectasia. So on the other side, you can see how it runs along the side. It doesn't occupy space. It's not running in the center of the spinal canal. But this one, you can see how that loops, and that is occupying space. And it's a vascular anomaly that is not often mentioned. 90% of dolichoectasias are asymptomatic. But when you get a hypermobility, when you get the ligaments torn in here to where it moves more than it used to, this thing can come and play, and that's what we think is happening. So that's pretty much what we came up with. We got some screenshots to run through this and tell this story quickly. Let's see here. There we go. There's the displacement. So yeah, it was the displacement that kind of brought our attention to it, because it doesn't look normal. And our current working diagnosis is that there's some sort of a fascia in there pulling it. So well, you can't do dry needling up in here, but somebody might want to do shockwave therapy in there to release any fascia or constricted muscle, because I believe there are muscle injuries. We have muscle injuries in the rest of your neck that we can feel and get to. Right in there, it's in the back of your mouth, really tough to get to. Anyway, so is this whole area swollen and inflamed, and the nerves inflamed because this is occupying space, functioning as a space-occupying lesion? Sure, that's a good current working diagnosis. Again, we found that the first rib on the left is a little bit lower. We're big fans of prolotherapy for them to tighten these things up. Yours actually is not too bad. I don't think that's what's really driving your symptomatology. So this is, we saw the ligamentous laxity. This is the joint space here on the left versus the right. Your spinous is to the left, your C3 is to the left. Again, when you wrestle somebody 150 pounds bigger than you and they try to rip your head off, you're going to have some injury in there. Oh, look at that. Okay. Well, there's another shot of that Dolichoectasia. This is the vertebral artery that's not close to the brainstem, and this is one where it's really close. Let's see here. Another shot of it indenting. So again, the radiologist won't mention anything about this, and they're typically dormant and not really giving symptoms, but you add a hypermobility in there, and this thing gets pulled back and forth, and your head rotations give you symptoms too. Definition of a Dolichoectasia. There's a great shot of it. Anybody with a mechanical mind can understand that this can come into play at some point. The normal anatomy. Again, we showed some other locations that are hypermobile. Left head rotation. Doesn't look too bad, but in your case, I think you're a sprain in your neck. You're not able to move as much as the other person. Any hypermobility with you plays out pretty quickly, I think, and you get injured pretty quickly. Again, there's a tendency to want to go by the textbook, but I don't think the textbook really applies to you too much because of the Dolichoectasia and the tortuous internal carotid. So any hypermobility in there is no good for you. This is the internal carotid plexus. So this is a sympathetic plexus. So you get stuck in this fight or flight, and it's real easy to figure that could be what's driving it. This is a good shot of the internal carotid, or the carotid sheath, internal carotid, normal anatomy. Everything's nice and tight in there. And I do think when they got in there, they kind of injured you up here in a no man's land. You can't get nerve conduction velocity tests up in there. There's a lot of things you can't get to, so it's a no man's land. So here we showed a muscle. Since we found so many muscle injuries, actually your right SCM was injured. We're kind of taking a little bit of a leap of faith that the rectus capitis anterior on the left is injured too. That's the muscle behind the internal carotid. And this is how it maps out with you. And when a muscle gets injured like that, it occupies space. So airway seemed okay. Again, looking for the atlas misalignment. All right, so we did left and right head rotations showing how that Dolichoectasia moves towards the midline and kind of moves all around in there. Anybody with a mechanical mind can kind of see that is not what you want. Let's see. Just to make sure I covered everything. I think that's the gist of it. I mean, yeah, the crooked atlas, I adjusted that. Oh, here we go. This is a good shot. So left and right head rotation. We're seeing the odontoid slide back and forth on the atlas, and I think that might be enough. That you have a great deal of symptoms whenever you turn your head, and because of that Dolichoectasia, the vertebral artery, I think that's what's happening there. So yeah, prolotherapy, tightening all that stuff up. Oh, this was the other side. So the right internal carotid was displaced this way. Now, we did correlate this one clinically. We were able to get in there and try to strip the muscles, and the whole SCM was just tight as if it was splinting you from a broken neck or something. So as we released that, we got some symptomatic relief, and you could tell that was, you were less pathological. So yeah, we tried to displace that, move it more towards the midline, and your body liked that. Your feet even got warm. So this is a right head rotation showing how it moves back and forth. And I've seen other people get injured from these submission holds. I had one guy that had a broken hyoid from it. All right, so the textbook would say that the ADI space in an adult 3 millimeters is within normal limits. And I think there are certain things in the textbooks that we have to write something, but this might be a little loose for you, and it might be giving you symptoms. As it gets tightened up, we'll find out. There's another shot of that vertebral artery, real close. And look how close it is there. Yep. I think, okay, that's it. I'm just repeating myself at this point. Any questions? Anything you want me to talk about?
I don't think so.
Okay.
I think you pretty well covered everything. Do you have any questions?
No.
Okay, good.